Hi, I'm Mohammed Moin for the Ophthalmic Foundation, and I'm going to be talking very briefly today about adult learning principles, no conflict of interest, and the objectives are that the participants should be able to describe the six principles of adult learning and to differentiate andragogy from pedagogy. So what are the six principles? Let's take them one by one. The number one is need to know. Number one thing adult learners will want from you is that they will want to know all the details of what they're going to be taught. And this is necessary so they can plan their teaching and they can learn ahead and they can discuss with you while you're teaching them. And this is why you get curricula and syllabi, which are given to the students before they actually start the year of their learning. The next principle is motivation. You need to motivate them because without motivation, adult learners will not actively learn. Suppose you're teaching them a pupillary light reflex, which is pretty simple and essential, but you need to tell them that you're going to learn this in medical school because at the end of your 5 years, when you become a doctor, this is very necessary when you're seeing patients in the ER to diagnose if they're alive or they're dead, diagnosing patient with different third nerve paresis, whether it's external or internal. So those are the things you're going to tell them the worth about why they are learning, because they always ask, why do I want to learn this? The next is you're going to orient them. They need orientation, and by orientation means we need to direct them in a certain direction. So suppose if they're looking at a picture or a condition which they see, by looking at that pattern, they can recognize that this is going to show us the signs of this disease. And if we see this, we can solve the problem and get to the diagnosis by going through various steps. The next is the need to be self-directed. Self-directed means that you have to leave them alone to learn by themselves. You need to just let go and be a facilitator. You need to see how they're learning and you give them a problem, let them sit together and come out with solutions by doing their own research. And then you can do critique and actively work with them for a constructive learning. Then they need to use their past experiences and they like to use new experiences during learning. That is very important. Suppose you're going to teach them phacoemulsification, so give them a wet lab so they have an idea about the experience. They can utilize their past experience of using manual hand skills to use that. Suppose they were good in woodworking or carving, they can use that ability of being ambidextrous to use that past experience to learn a new experience. And the last one is readiness. You need to make them eager to learn and you make them ready to learn, and it is different from motivation. So in readiness, suppose we give them gamification. We ask them to have an incentive that they're going to win if they answer more quickly and the correct answer. So that gives them some readiness and which makes learning more enjoyable for the students as well. So the six principles, if we recapitulate them, number one is the need to know. Number two is motivation. Three is orientation. Four is self-direction. Then they need experiences, and then they need to be ready to learn. Now, just quickly going through when we were young adults, how did we learn? We learned as passive learners, but as adults, we learn as active learners and we use self-reflection. The structures were hidden in children. We didn't know our curriculum that well, but structure is predefined for adults. Lectures were the main format when we were children, but in adults, interactive format is the preferred because they want to ask questions, they want to interact. And it's impersonal for children, but it has to be personalized and individualized for the adults. There was little application in children, but adults, obviously, They need to know that from the past experiences. They need to join their prior knowledge with the new knowledge. They need to have application of skills. And in children, you always told them this is pass or fail or submit a feedback. In adults, you need to give them different opportunities to learn the same thing. If they don't come up to the mark, don't discourage them, just failing them. Give them another opportunity to come up and solve that problem. So in conclusion, application of adult learning principles avoids wasted effort, reduces better retention, is more enjoyable for the adults, has faster results, and it has better accountability for teaching. Thank you very much for listening to this short video, and you can see details on adult learning principles by going to OFEC Teaching Skills for Ophthalmic Educators online series, which is the QR code. Thank you very much again for watching.